Great, thank you, Mary Lou. And thanks everybody for joining us today. Very excited to have our panel. And I hope you all feel connected to the NTSAD community after today's kickoff and the support sessions. So for those of you who I haven't met yet, I'm Deanna Pangonis, Director of Family Services for NTSAD. I've been with NTSAD for over 25 years, and I've seen how much the landscape has changed, not only in the realm of caring for a loved one, but in the world of research, which means the need for rare disease advocacy on the local and national level has increased as more and more potential treatments are developed for rare diseases. Today's session is about what advocacy means and the impact you can have by telling your family story and sharing your experiences. I'm excited to introduce you all to Stephanie Fischer, a super rare advocate and patient herself who's been a very good friend to NTSAD and has helped me and helped all of us understand how to navigate rare disease advocacy. And Abby Rogers, mom to Ben and an advocate herself, who's familiar with how patient advocacy can make a true difference. And we will also be joined by Bill Berry, someone we got to know when he coached our late onset adults for an FDA listening session that we held earlier this year. So it's safe to say that you're in good hands. Please remember just to keep yourself on mute too during the presentations, and feel free to post questions in the chat feature and we'll answer them at the end. So thank you very much. And Stephanie, I'll hand it over to you.
Great, let me share my screen. Hi everyone, thank you very much for joining us today on a somewhat chilly afternoon. Just to follow up Deanna's introduction, I'm a rare disease patient. I actually didn't know I had a rare disease until it caused a stroke when I was 29 and working on Capitol Hill for my hometown member of Congress from Pennsylvania. Since then, I've worked at the Biotech and Pharmaceutical Trade Associations. I spent 2.5 years leading patient engagement and communications at the Abigail Foundation for Rare Disease and consulted for Global Genes for a year. I currently serve on the Pennsylvania Rare Disease Advisory Council and on the board of Narcolepsy Network. As Deanna mentioned, I've known and enjoyed working with NTSAD staff for several years, and this is actually not my first conference, so excited to be here again and talking about an issue that's really important to me personally. I think the first question is, what is public policy? Just a level set, and then why does it matter? So public policy is actions taken by the government at the state or federal level, and then sometimes it could be even more local, maybe by a county, which we see in Pennsylvania now for COVID vaccine distribution, which has not been handled well. But approaching a problem for society as a whole or specific segments rather than on an individual by individual basis. Public policy through legislation and regulation. We'll be talking primarily about the Food and Drug Administration when we're talking about regulation today, can help address some of the challenges that are faced by patients living with rare disease and their families. Currently, you may already know this, there are more than 7,000 rare diseases, and between 93 and 95% of rare diseases have no treatments approved by the FDA. So clearly there's room for improvement in the development of new treatments. And then once we have treatments, how can we ensure that patients have access to them as soon as possible? That insurance companies are not throwing up a lot of hurdles that are going to stand between patients and the medications that can help them with their disease progression or to manage symptoms on a day-to-day basis. You can also, even if you're not an individual patient, a caregiver, a care partner, researchers can be really important and have a unique perspective to share. And Abby will talk about you can honor a loved one by advocating in their memory, so that future patients, future families don't face as many barriers or to make their path a little bit easier. One example of how public policy can make a difference is the Orphan Drug Act of 1983. Prior to the Act's passage and being signed into law, only 10 medicines were developed by the biopharma industry for rare diseases, and since then, more than 500 have been approved by FDA. So the Orphan Drug Act has been widely seen as very successful in encouraging companies and giving them some incentives to focus on treatments for rare diseases with much smaller patient populations than something like COPD or diabetes, will be able to sell their medicines to many more people. And so we do need those incentives for companies to continue to focus on rare diseases, even with some of the unknowns. You know, there are unique challenges in rare diseases. And we'll talk about this when we talk about a current piece of legislation that could help the rare disease community that NTSAD supports, but there are unique challenges. And so the Orphan Drug Act is one policy that has been successful in encouraging the development. And, you know, it's been working well. I personally, as an advocate, hadn't thought about the need to defend it. However, in the very large tax bill that was passed by Congress in 2017, it actually cut one of the incentives, the orphan drug tax credit. It got cut in half. The House bill actually eliminated it completely, and the Senate bill reduced it. Fortunately, the National Organization for Rare Disorders led efforts to defend the tax cut, and those efforts, working with a lot of other individual rare disease foundations, instead of being eliminated, it was only cut in half to 25%. And so what did we learn? The first is ongoing education of Congress is critical. Members of Congress need to hear from residents of their community about their experience living with rare diseases, the impact that rare disease has had on them as a patient or on their family. Meeting patients, families, researchers can make an issue real. Building relationships with staff is important. I can tell you this, I worked on the Hill for 4 years. The staff members work really hard. They research issues. Oftentimes they decide whether or not to bump an issue up to get a member's attention, get the feedback from that member. They work with other offices to sign their member on as a co-sponsor. They can do Dear Colleagues that go to all members or all members of the same party as their boss to try to get other offices to sign on. This can have a huge impact. We've seen this when I worked at the Every Life Foundation for Rare Diseases. Individual patients and families had such a big impact that we saw that staff members, even when they left one office to work for another member, they continued to be champions for the rare disease community, and that often got traced back to one individual patient or family who that staff member got to know. And so if you, we'll talk, there are organizations that can help you set up meetings with your members of Congress, or if you work to meet your local state representative or state senator. Even if you don't get to meet with a member, your first meeting or subsequent meetings, you can have an impact on staff, and that impact can translate to real results. Another lesson learned was that numbers matter. Again, I can tell you from working on the Hill that while my boss often knew how he was going to vote on a certain issue, and other times it came down to, we gave him a daily count of how many people called or sent emails or came to the office or were requesting meetings to talk about a certain issue. So because rare diseases are rare, if each of us can have a few other people, Abby, I think it's going to talk about this. There may be people who come to you and say, hey, we want to support you. You're living with a rare disease, or you have a child with a rare disease. What can I do to help you? And one thing could be, could you take 5 minutes and here's an email, or here's a URL. If you can go to this and send a message to the member of Congress and ask for his or her support for something, that's something tangible they can do in just a few minutes. And so we as a rare disease community, patients, caregivers, researchers, even members of the biopharmaceutical companies we may hear from tomorrow, we all need to take a few minutes and learn about some of the initiatives or legislative bills that could be helpful to the community, because numbers do matter when it comes down to encouraging a member of Congress to take time to sign on to a piece of legislation and to vote for or against it. Another lesson learned from the Orphan Drug Act and the tax reform bill is that in addition to championing legislation that we think that could be be helpful and have a positive impact. Sometimes we need to go on the defensive and actively oppose legislation that would be harmful. Another example, in 2018, there was a bill that would have weakened with the Americans with Disabilities Act, and that could be very harmful to the many people living with rare diseases that do have disabilities and need some of the protections of the Americans with Disabilities Act. I personally felt very passionate about the Affordable Care Act, the protections for people with pre-existing conditions, the ban on lifetime caps that I know is an issue for certain rare disease communities. And so every time in the previous Congress that the Affordable Care Act, there was legislation to weaken it or undermine it, I contacted my representative and my U.S. senators and asked them to oppose it. So we need to go on the offensive for legislation that would help the community, and then be defensive for what does work, because we don't want to lose any of the small gains that we've made. So building a relationship with elected officials and their staff is similar to building any other relationship in your life. It takes a little bit of effort. Call, email, and meet with your U.S. representative and senators, and this can be in person. Normally, I would have a picture of myself meeting with my member of Congress, but all of the meetings, as you know, in the last year and a quarter have been virtual. It's not quite as, I haven't found it quite as impactful as really sitting across a table and staring someone in the eye, but I'll take any opportunity I can get to make my case. I do want to mention, I know this can be intimidating if you've never met with, a state or federal official. They want to hear from their constituents. When I worked for a member of Congress, there were certain people that he saw every year. Every year, the Chamber of Commerce would ask him to come in and meet with local business owners. The Pennsylvania Medical Society, every year, some doctors from the district came in and talked to him, but we actually would have multiple brainstorming sessions on how he could meet other people in the district to learn what was important to them and to share with them what he was working on. So the office, don't feel intimidated. The member of Congress works for you. I wouldn't say this, and I didn't like to hear it as a staff member, but your taxes actually do pay their salaries for the member and the staff. Again, don't tell them that. It doesn't usually go over well, but keep that in mind. They do want to hear from you. And that's their responsibility and their job, is to hear from constituents like you. And the only thing that you're expected to be an expert in is your lived experience as someone in the rare disease community, whether it's a patient, a family member, or a researcher. Even if you're talking about policy issue, the most important point is, why is it important to you? You'll hear from Bill later about how to tell your story. I like to work in some aspect that ties into the legislation that I support, so that part of my story sets up the problem, and then I can tie into whatever legislation I'm going to be talking about as how that is at least a partial solution. But don't be intimidated. Even I'm going to talk about the STAT Act in a little while, and it has 4 components, and each of those has a lot of data points. So during our Q&A, I might have to say to someone, you know what, that's a great question. Thank you for listening, and to think about it, I'm going to have to get back to you. I do have some notes, but there's a lot of them. And so as long as you make sure you follow up, because again, that's part of being building credibility and building a relationship with an elected official. If you're going to ask them, you want to tell your story, but usually you want to take that opportunity to have an ask, whether it's to vote, be a co-sponsor of legislation, or to vote a certain way on a vote that's coming up. Follow up with them afterwards. Again, part of building the relationship. So if they've co-sponsored what you've asked them to, thank them. If they haven't, asked if there's any other information that they need before they feel comfortable signing on. Attend, again, mainly outside of a pandemic. If they have a town hall and you can attend, go. There might be a chance to ask a question, which you can tie into whatever your ask of them was. If they're hosting other events, it's just to build a relationship and reinforce that you are part of their community. And I'll have a few, action items to help you with this. And again, don't be intimidated. There are several rare disease organizations that can help you with us, and it's that all of them offer resources and events that are completely free. The first one is Rare Disease Legislative Advocates. It is a program of the Real Life Foundation for Rare Diseases. All of their resources and events are free for patients, caregivers, and other advocates. They understand it can be expensive to live with a rare disease or to have a family member with a rare disease, and they don't want cost to be an effort. They even provide stipends for, again, outside of pandemic when people actually gather at the same place, but they actually offer travel stipends for public workshops and events hosted by the Food and Drug Administration and National Institutes of Health to give rare disease advocates the opportunity to meet directly with regulators and researchers to make sure that those important folks hear directly from the community that they're serving. So RDLA, their focus is on public policy, and they want to empower patients, families, and other advocates to work directly with legislators and regulators. And they have an online advocacy center, legislative clearinghouse. They have monthly webinars that any individual and organization, and even sometimes member of Congress or their staff will join the monthly calls to talk about legislation that they feel will be important to the rare disease community. The attendees are always welcome to ask questions. They don't always get to them live, but staff will follow up afterwards with answers to the questions, and then understanding that not everyone can be available at noon, midweek. They're recorded afterwards as a resource. Something that RDLA has started doing relatively recently is a lot of their resources, including webinars, now have live Spanish translation to try to make them accessible to more people in the rare disease community. There's also monthly update newsletters that will have updates on policy news, action alerts from a variety of rare disease organizations, and upcoming events, whether they're in person or virtual. They also have a series of events. Rare Disease Week on Capitol Hill, outside of pandemic, brings 900 advocates to Washington, D.C. It's usually around Rare Disease Day, which is the last day in February. So it is usually at the end of February, beginning of March. This year, they actually, and then Rare Across America, that sets up meetings for advocates in the local offices of U.S. representatives, their individuals, U.S. representative and U.S. senators during the summer district work period. So it's usually late July and August. This year, RDLA switched those two events. So I participated in March. I had meetings with staff for my representative and both senators. The goal was, or the hope was, to be able to bring people together in DC in July. However, they announced a few weeks ago that because Hill offices are still not taking in-person meetings, it will be virtual this year, and registration just opened this week. It'll be July 14th to 22nd. There's a series of events, including a training more in depth on why public policy is important. They'll provide an overview of different bills. One of the things that I really like about RDLA's events that it's up to each individual advocate to choose what issue to bring up in their meeting. So it's always your choice, because even if two families are advocating through NTSAD, they might have different priorities. So while you'll get education on a variety of bills, it's up to you what you want to talk about in your meetings. Another thing that I want to point out, in case you have anyone joining us who is between the ages of 16 and 30, is the YAR program. It's the Young Adult Representatives of RDLA. And so there's some training and peer support specifically for those young adults. Another organization that has a lot of free, I'm sorry, my cat wants to be an advocate too, has a lot of free resources is NORD. They work very closely with FDA and NIH. They issue action alerts. They have sign-on letters. They also have a really robust state program called the Rare Action Network that has policy at the state level. And so outside of the pandemic, they do in-person events at the state capitol for Rare Disease Day. Over the past 14 or so months, they've done some virtual get-together so that rare advocates within one state can learn about each other's diseases and do a little bit of networking. They also work for states that don't have rare disease advisory councils. They're working with advocates, for instance, in New Jersey and other states to work with legislators to get those enacted. They also do state report cards. So if you're curious, you could go to the link, and all my slides will be available afterwards. You can see how your state does on issues such as newborn screening, which Abby is going to talk about, which is really important to many rare diseases, whether your state has a rare disease advisory council, and how they do on a few other key issues. And again, all available at no cost. So the first step, if you don't know who your representative and senators is, we've all had to start somewhere. You can go to this link based on your address. I encourage you, if you're on social media, to follow them on Facebook and Twitter. Most members at this point are on both, although not necessarily. There's some who are really old school. Visit their websites and sign up for their email newsletters. They can give you some good insights. For instance, my representative recently met with several hospitals in the district to talk about COVID vaccine distribution. And so it's just another way to make a connection. For instance, if you notice your member was at a hospital where you've received care for your rare disease, or maybe your family member received care, it's just something to remember the next time you meet with them, to reinforce that you are part of the community, and just to make a connection so that they can relate to you a little bit better. And then again, if you're interested in either RDLA or NORD, I encourage you to sign up for their websites, their action alerts, just to make it easier to stay on top of some of the pressing issues. One of the current issues that Deanna asked me to touch upon, NTSAD has signed on to support, is the STAT Act, the Speeding Therapy Access Today. It was introduced in both the House and the Senate last month. It is bipartisan, which means it has support by both Republicans and Democrats. Everly spent more than a year through the Community Congress that brings together representatives of dozens of rare disease organizations, as well as biopharma companies, to talk about room for improvement in public policy. They also have another on newborn screening, but in this case, public policy. So more than a year soliciting feedback from stakeholders to think about what could really move the needle in rare disease drug development, and also access to therapies once they're approved. And so the answer after more than a year of work is the STAT Act. It currently has 6 sponsors and co-sponsors in the House and 2 in the Senate. So they have a lot. They have a lot of ground to cover. My representative, we talked about this in our Rare Across America meetings in March. Everyone who was in my representative's meeting, all of the advocates were supportive of the STAT Act, but I checked today, he's not signed on yet. So I have an action item for myself, is to follow up with the office with more information and see if they have any questions or why they haven't signed on yet. And there are, as I mentioned, if you, we're doing Q&A later, and I'm happy to take questions, and I may need to follow up, but happy to do that. There are 4 main components. The first is an FDA Center of Excellence to focus on the unique challenges across rare diseases. We saw an Oncology Center of Excellence that was established in 2017, and so there is precedence for this. It would increase collaboration across centers at the FDA, centers and divisions, and it could provide additional support and expertise to inform the review of potential new medicines to treat rare diseases. Another component is an advisory committee to the Secretary of Health and Human Services. The members would have expertise in regulatory policy, patient advocacy, patient-focused drug development, and economics. Another component is focused on very small patient populations. So rare disease in the US, the definition is 200,000 or fewer patients, but there are other diseases. I have a friend whose son was the first diagnosed ever with the disease. So there are some communities within rare disease that might have 15 patients worldwide. And so the challenges for developing medications for even smaller patient populations are even greater. And so this component would set up something called accelerating life-saving treatments and treating ultra-rare disease entities, altitude, that would have recommendations for very small disease populations, clinical trial designs, manufacturing, and things like that. It would also have grants to assist in developing practices, again, specifically for really, really small patient populations when it comes to regulation, chemistry, and manufacturing, to try to help encourage the development of treatments for those, regardless. I love Every Life's policy as no patient population is too small to deserve treatment. And so this is focused on those ultra small patient populations. And then the fourth is access. So for me, the only thing worse than not having an FDA approved medication is having an FDA approved medication and not being able to access it. And we have seen issues, for instance, in the Duchenne community, even after a medicine is approved, insurers may put hurdles or delay access to having the medicine approved so the patients can access it. Meanwhile, if it's a condition that is progressing, the patients may be losing functioning that they're not going to be able to regain even once they access the treatment. So this fourth is aimed at enhancing coverage of treatments for the broadest patient population as possible once a medicine is approved. In the past, like in Duchenne, insurers have sought to limit access only to patients that met the criteria of those that were included in clinical trials, but FDA's approval was intended to apply to a broader patient population. So this effort could help with that. And you can help. So I will, when I'm done speaking, when it's Abby's turn, I will go ahead and put in this link for anyone who might be interested. Every Life tries to make it as easy as possible. And as I mentioned, NTSAD is supportive of this effort. There's a tab that says take action, and then you can just click on this red box. They give you two options. The first is to compose a message to your representative and senators. And then the other is to place a phone call, and they'll give you a script that you can modify until you're comfortable with it. I know it can be intimidating to call a congressional office, so if this is your first time, there's nothing wrong to wait until you're in the weekend, and then you have your script and you can leave a message. And again, Every Life tries to make this as easy as possible. And so the script, for instance, has the bill number. That's really important. You want to make it as easy as possible for the member of Congress to do what you're asking, which in this case would be to co-sponsor the legislation. And I think I'm okay on time. So just quickly, this is a personal passion of mine. Another way that you can make an impact on social media without taking a lot of time is using social media for advocacy. Primarily Twitter and Facebook, since you can include a link for people to learn more or to take action. And so if you're on Twitter, even if you have 15 followers, this isn't limited to the massive influencers with thousands of followers. Use your Twitter, your Facebook, your LinkedIn accounts. If there are posts from organizations that you work with and trust, like NTSAD, if you work with Every Life and you're comfortable sharing their action alerts, I do find it, if you're going to share it, that's great as a first step. If you can add a line or two of why it's important to you, that can really inspire the people who follow you, who maybe aren't in the rare disease community and don't know some of our challenges that we need fixes for. Adding a line or two of why this is important to you can really prompt people to take the next step of clicking on the link to learning more and hopefully taking action, since it's the goal. And so for each of us to share those action alerts can really amplify the efforts of organizations like NORD, like NTSAD, and like Every Life Foundation. And because as we talked about, for the Orphan Disease Act, the lessons learned is that numbers matter. And so that's amazing if all of us who are on this call watching this, if we all contact our members of Congress to ask them to support the STAT Act, but if we each do a Facebook post and inspire 2 or 3 more, then we have our impact has grown exponentially. Again, even if you don't have a large following, at least on Facebook, those are people who hopefully care about me if we're Facebook friends, and so they may be looking for ways to help me as a rare disease patient. For the STAT Act in particular, if you're interested, the hashtag is STAT Act. So you can search very quickly on Twitter or Facebook or LinkedIn and go ahead and share or do your own original post with a link back to that Take Action page that I'll put in the comments. And then you can also use social media as part of building a relationship with your member of Congress. That's me with my congressman on the left-hand side. So anytime I meet with him, even virtually, I had a picture from our Zoom meeting in March. I do a tweet to thank him for his support. He's a member of the Rare Disease Caucus. He was one of the original co-sponsors for the newborn screening legislation in the last Congress. So, thank them for meeting with you. If they've agreed to support something, thank them for it. If you've asked them to do something and they haven't committed, reinforce that ask by putting it in the tweet, and then that's a little bit of pressure. Again, always be respectful. This is a long-term relationship building. Name calling isn't productive. And I think I forgot to mention earlier, your party affiliation and the party affiliation of your elected officials. For rare disease advocacy, it really doesn't matter. We need champions in both parties. Unfortunately, we have champions in both parties. That's how the STAT Act has support. Even though they only have 8 co-sponsors so far, the lead co-sponsor in the House is Gus Bilirakis, who's a Republican, and the lead sponsor in the Senate is Senator Amy Klobuchar, who's a Democrat. We really do need champions in both parties. Also, don't make assumptions based on parties. I have been pleased. There was one meeting I was going into and the advocate's like, this person's not going to like me. I work for the other party. I said, that shouldn't matter. You're still a constituent. Your story, your voice is still important. And before we even got past introductions, the chief of staff was like, we're so excited you're here. My boss is leading an effort on this bill that we think will really have a huge impact for the rare disease community. And so your individual story, regardless of party, can really be impactful. So don't let that. That's great if you voted for them. It's okay if you didn't. If you didn't, just don't mention it, because again, you want the discussion to be respectful and productive. Here is a few first steps. Find and follow your senators and representative on Twitter if you're on that platform. There's a blog post on how to use social media to engage with policymakers. And I do not want to cut into Abby's time. I'll be available for the Q&A. Deanna has my contact info, and you can find me on Twitter and Instagram as Rare POV for Rare Point of View. So thank you.
Thank you. This is Abby Rogers. I'm presenting next. I am going to share my screen. I did want to say that currently I do work for the State Health Department in New Hampshire, but I first and foremost love to be identified as Ben's mom, which I am. I'm very proud to be. So I'm going to share my screen, and then I'll talk a little bit about what it's like to work with parent advocates. Let me go back one. There you go. Okay, so again, my name is Abby Rogers. I'm very pleased to be asked today to participate in this discussion about advocacy. This is me with my son Benjamin. Ben was diagnosed with Canavan disease in 2002. And prior to that, I was working, both my husband and I worked in the arena of policy. We both had stints working in Washington, D.C. By the time I had Benjamin, I was at home with him, which was terrific. And when he was diagnosed with Canavan disease. Obviously, that was a life-changing event. And just really, really happy to be connected with NTSAD and everything that they bring to families, support, information, research, and a sense of community. So I hope everybody is having a great time, and we'll have a great time at the conference. I'm really looking forward to the research section tomorrow. But in the meantime, I'm going to talk about advocacy. So I'm going to share some more information. I come to this discussion, again, with some background in policy, and also as an advocate myself, most lately, and also working with families in a professional sense, at sort of after Benjamin, when Benjamin was able to be a little bit more stable with Canavan disease and had some nursing. I went back to work part-time and worked with other parent advocates. So I'll explain a little bit about that. So I'm going to talk a little bit about advocacy first. So advocacy can be described obviously as, there are different forms of advocacy. Stephanie talked about advocacy in the sense of advocating on Capitol Hill and with legislation, which is a great goal for families to protect rare disease patients and advance the cause of research or anything that would make a difference in their lives. I mean, certainly when you talk about, these are the 4 that I'm going to discuss really quickly, mostly focusing on parent advocacy. So self-advocacy is really taking the action of representing yourself or your views of your interests. Parent advocacy, I'm going to talk about in a second, but for individual advocacy, that's sort of one-on-one advocacy. And you can think of it in the way, like the best way that I can think about it is when you have a one-on-one aide in school, right? You have someone that's helping someone with a rare disease or chronic condition advocate so they can live their best lives and experience school in that way. Supporting people to exercise their rights and assisting them to voice their concerns would be a more apt way to put it in a public policy setting. Systemic advocacy really is working toward a broad change in policy or practice, similar to what Stephanie was talking about in legislative or regulatory arena that affect big systemic change, like making broad sweeping changes in legislation or in regulatory areas that would help patients with rare disease, make some changes for them and their families. So another way to talk about advocacy too is these ways of looking at it. Really what you want to do is look at enabling, like what does that mean? It's basically helping people achieve their full health potential. Also related to that is something called safeguarding, which is speaking, I'm going to talk about it in the realm of public policy, obviously, encouraging good public policy and best practices to keep good policy in place that help people with rare disease and chronic conditions. Supporting those that need policy changes to live their best lives, people who experience rare disease and chronic conditions. Speaking up also, individual advocacy and lending your voice either as an individual or to a group or organized effort to affect change. And the bottom line is empowering. Once you feel empowered to use your voice to make change, that's important. Is it whether it's for yourself or for your child or for a loved one with a rare chronic disease, working together and unifying your voice with a group of other larger community can be very impactful to advocacy. So parent advocacy is what I'm most familiar with. And these are my kids. This is Benjamin in the middle and Sam and Oliver. This was a visit to Benjamin's school which is at the time a new school that previously had not been accessible to kids that used adapted strollers or wheelchairs. And our family, I think, was instrumental in talking about how to best accommodate that so Benjamin could go to school. I mean, that's advocacy on a small local level, of course, but you're still advocating for equal rights for your child to attend a school. And it is part of the ADA. Our school just happened not to be accessible, which was kind of unbelievable, but working toward that. So parent advocacy is concerned with advocating on issues that affect a child or children by parents or organizations representing children. So here, this is a picture of myself with Senator Kelly Ayotte. She was a senator from New Hampshire. She's no longer in office. This was in a role that I had when I had an advocacy legislative role at a national nonprofit advocating for premature birth, funding for premature birth, infant mortality, and birth conditions, which would affect a lot of conditions represented by NTSAD and other organizations, including rare disease. And I chose this picture because I'm here in a professional role. The woman on the other side of Senator Ayotte is a woman who had a premature child, who was also there joining me as the legislative person to talk about the issues that were important to the organization. And as I said previously, that Benjamin, I had a role in policy in my early professional life. And when we had children, I was at home. When Benjamin was stable enough to have a nurse and I could spend some time out of the house, just a little bit part-time, which was tough, but I found that this was a very rewarding position. It allowed me to kind of dip my foot into the realm of advocacy for an organization that I think very much aligned with my personal experience. I could very much relate to the chronic care piece of babies that had left the hospital with equipment, with a suction machine, with a nebulizer, with a vest, all the equipment that we're so familiar with taking care of kids with leukodystrophies or other diseases. So it was just a very interesting experience to go to Capitol Hill, work with parent advocates, and really see how people from all over the country could come and talk about their similar experience of why it's important to prevent preterm birth, to affect change at that level. And really, the reaction from the legislators was one of, they're so very thankful that people had come and taken time away from their families, especially from a child with a chronic condition, and make arrangements at home so they could be away to come and tell their story. Legislators are super busy, as everybody knows, but really at the end of the day, they represent their constituents, as Stephanie mentioned earlier, and they want to hear from constituents. And not only that, but they want to hear how what they do in Washington or on the state level, or even on the local level, affects the people in their community. And I think some of the stories certainly that people tell about children with rare diseases or family members with rare diseases are really, really impactful. And I would urge you, if you wanted to dip your toe into that arena, that you do that. It's sort of baby steps. It is, as Stephanie said, sort of a unusual atmosphere if you've not been in it. But once you get used to that, it's really great. And I think it's very rewarding to share your story and your family's story. So I wanted to share a quick story about two little guys that I worked with. One in particularly, the little boy on the left, his name is Parker. When I worked at the organization I was talking about earlier, Parker and his mom worked tirelessly to get a piece of legislation passed in New Hampshire. And I just wanted to use it as an example of how somebody can make a change, somebody with no experience and somebody with a story to tell. These little guys were advocating to add critical congenital heart disease to the newborn screening panel. Parker was born with a condition called hypoplastic left heart syndrome, in which one of the chambers of his heart was missing. And as a result had a long road ahead with some surgery and other things. And the newborn screening panel is a national, and I'm sure many of you are familiar with it. I'm gonna just skip ahead to my next slide. Newborn screening is an essential public health strategy. All babies in the United States are tested ideally between 24 and 48 hours of birth, using a blood spot test, which tests for conditions which could either be congenital, inborn errors of metabolism, genetic, or endocrine disorders that can be absolutely devastating if not caught early. There could be developmental issues, and some disorders, as we know, if they're caught early, there are treatments for those, and there are interventions. And ideally, that every condition that has a treatment would be able to, that would affect a pediatric population, would be able to test at birth. There are, in addition to the blood spot test, there's hearing and now critical congenital heart disease. But early detection is key, and a lot of parent advocates of children with conditions that are tested on the recommended uniform screening panel do advocate for those screens to be added, others that to be added, so parents can have the assurity that when their child is born and they're tested in the hospital, that they will know that there would be a treatment for them. So when I get back to, I'm just going to go back to my picture of Parker for a minute. So what happens with the newborn screening advisory panel is there's a screening test recommended at the federal level, and then it's up to states to adopt that individual screening. So in the case of this was 2011, I believe 2010, and I wanted to just tell this story because what happened was the critical congenital heart disease test, which is done, simple test. It's not a blood spot test. It's done through the use of a pulse oximeter. So for those of you that are familiar with that, I mean, I certainly am, that you would, wrap the simple adhesive strip around the finger and test in the hospital. So the idea is it's simple test, it's non-invasive, it's not expensive. And Parker's mom, Casey, went to the newborn screening advisory state committee in New Hampshire and testified that she believed, her child had critical congenital heart disease. And she thought that this test, which is recommended at the federal level, should be tested here in New Hampshire. And she walked out of the meeting shocked and amazed that the state advisory council voted against adding that screen. And she couldn't understand it. And at that point, neither could I understand why this simple test would not be able to be added. And that's part of, I think, the learning process when you advocate for something in a regulatory or a legislative arena is why wouldn't a state panel add a disease that would save babies' lives, right? So why wouldn't it? Well, come to say, like, the hospitals don't know how to implement it without additional funding. The equipment is, who's going to buy the equipment? That has to be added into the hospital budget. There could be some administrative costs around implementing the program. So those are all the things that, if you come from a situation of being a parent of a child with a chronic condition, it's sort of mind blowing to think, okay, like these little things are not going to be added because of this, but that's why it takes people to advocate and takes voices to change minds. So what happened was Casey had gone to the newborn screening advisory committee, and that was a no. That was not going to be added. She felt very, very strongly about it. And she went to the legislature in New Hampshire, and she found her state rep, and she explained why this test should be added to protect her child and other children who have critical congenital heart disease. This happened to be a very Republican or like a very conservative group of legislators that were not going to add something that was going to cost extra money. The screen had already been rejected from the traditional sense, and this is how you add the screen through the newborn screening advisory committee. So she had a lot of things stacked up against her. She and another mom teamed up. They went from legislative office to legislative office with Parker in tow, who was 4 at the time, and the pulse ox. And it was a very, very close vote. But at the end of the day, she prevailed, and the bill passed, and this screen was added to the New Hampshire newborn screening advisory panel, even as the state health department said, no, we don't want to add it yet. So this is the power of advocacy. She is a mom, and she knew that this test would save babies' lives. And in fact, within the first year that this test was implemented, 5 babies were detected to have critical congenital heart disease, and basically were been able to have the necessary interventions, so their outcomes were better. So I just wanted to tell that story because I worked with the March of Dimes in the concept that we wanted that passed. I ended up aligning with Casey because we had both, the goals were the same, as to try to get this screening on board for babies in New Hampshire, and it was successful. So I just wanted to use that story as an illustration that advocacy does work, you can start at the very basic level. This is a picture of my family with my husband, Bob, and Benjamin on the right, and Sam and Oliver on the left. And I would say that, this is why I now do advocacy. I mean, I've done it before. Benjamin passed away from Canavan disease unexpectedly in 2014. And I have worked since that time to be involved with as much as I can having to do with rare disease advocacy. I also am on the Rare Disease Advisory Council in New Hampshire, which is a legislatively formed council. I advocate whenever I can. And I would say now, you know, I was sort of advocacy, I said, as a professional person before having children, having some experience on Capitol Hill and understanding advocacy in the legislative process. Having the opportunity now, when Benjamin's not here every day with our family, to advocate for him, to work with families, it's a wonderful way to make change for other families and really try to, in his memory, try to make small changes that will hopefully be big changes for families with rare disease, because we all know that it's very, very difficult to find funding for rare disease. We obviously love our family members with rare disease very much, and we want their lives to be the best and most meaningful. And so you can do that through advocacy. You can do that at the local level, and you can do that at the federal level, and you can start small. And whether you, if you have no experience with advocacy, you have to realize that the minute that you have a child with a rare disease, you are an advocate, right? You are in the doctor's office talking to doctors that some may not know anything about the disease that your child has. You're advocating for your child to have what they need in school. You're advocating with friends and family so they understand what this means for your family. And in my case, you know, well, Benjamin doesn't like that noise. That's why he's making that face, because Ben was nonverbal. And some of you can and probably relate to that. Or he doesn't like that. Well, how do you know? Because I know his signs and signals, and you may not, but you're advocating for a nonverbal child, and you're advocating for everything. You are that child's eyes and ears and voice. And so I think advocacy, you know, on the political level, on the local level, anything to make change is terrific. But like you already have the skills to be that advocate by just having a child with needs that you advocate for every day. So I just like this quote from the Lorax. My children are now 17 and 14, and they don't read the Lorax, but they did when they were this age, and they're in that picture. So unless someone like you cares a whole awful lot, nothing's going to get better. It's not. So I'm happy to answer any questions that anybody might have, certainly during our Q&A, or if you want to reach out to me. You know, advocacy starts small. And as Stephanie mentions, if you have family and friends that you have that say, oh, I really wish there was something I could do to help you. What can I do to promote or to do anything? What can I do to help? You know, I know that you have a lot going on with your family and your child with the rare disease. And, you know, sometimes you get to say, you know, there's nothing really you can help me with right now, or maybe there is, but if you want to just turn them to an advocacy organization or to NTSAD or some of the resources that Stephanie mentioned, and say, you know, well, this is what you could do. And, you know, that would be great. And then you're making them feel better by helping, and they're also advocating for the greater good. So thank you so much for the opportunity to share my slides and my pictures of my family. And I really appreciate it. Thank you.
Hello, everyone. It's Bill Berry. It's great to meet you today. I'm calling up my slides right now. Hopefully this will work. I work in public relations, and our agency, Berry & Company, started working in rare diseases about 25 years ago with our first client, Genzyme. And the goal in public relations is to raise awareness, to help people learn about different issues. And we recognized very early on that having patients share their stories and caregivers share their stories was by far the most effective way to help other people learn about a serious health issue. But in my sort of naive thinking at the time, I said to the Genzyme folks, but who the hell would do this? Who is going to share these personal insights with strangers about something that is incredibly challenging, very emotional, and, you know, forces you to put your heart on a table? And what we found is that for many members of rare disease communities, and then it was Gaucher and Fabry, but eventually so many more, it was not that we had to convince people to share their stories to make a difference. We almost had to try to stop them sometimes because they were so anxious to do this, because they wanted to raise awareness, they wanted to help their own families, but they also didn't want any other families to have to go through the same challenges in terms of understanding these issues, getting help that they had gone through. They were dedicated to making it better for people. And it was incredibly encouraging and, shows the good side of humanity that people were willing to do this. So today, we're just going to talk a little bit about how to tell your story, because intuitively, you know how to talk about your family and your experience, but with different audiences, there are different goals in terms of the details you share, the types of information they need to hear, and what will make a difference for you. And so today we're just going to talk through some very simple strategies to help you prepare for any type of opportunity, especially with a government official, to tell your story. There's a lot of talk now about sort of presentations being storytelling. You make it into a story, and that's absolutely true. It does have to have a little linear flow. You do have to help people understand by giving them details, almost like it's a story. But you also want to inspire them to take action. You're telling them your story for a reason. And so you have to think in advance, what is that reason? What do I want them to do with my story? And in most cases, when you're talking to the FDA or government officials, elected officials, you want them to support your community. So part of your story should be the details of your history, but there should also be an ask in there. You should be saying to them, I want you to do this. Based on what you've heard about my story, you understand the challenges our community faces. This is what I want you to do. So we'll talk a little bit about how to do that as we go through this. But before I do, both Abby and Stephanie talked about people's telling their stories and the impact that it can have. And Stephanie talked about NORD, which I think many of you are familiar with. This is the story of Abby Myers. And many years ago, in 1983, I guess, she had a child with a rare disease, and she started talking about it as best she could. She started talking about it to help people understand it, just to try to raise awareness. I don't think with any long-term plan in mind, but just to try and make a difference. And she started talking in meetings and reached out to government, and she also talked to the media. And it happened to hit on a reporter at the LA Times who did a story about her experience. And that led the producers at a TV show called Quincy many years ago to do a whole episode about rare diseases, about this rare disease. And at the end, they mentioned Abby's work. And that led to big support for the organization she founded called the National Organization for Rare Diseases. And that her effort led to the passing of the Orphan Drug Act. And the Orphan Drug Act, of course, is a historic advance in efforts to support people with rare diseases that is still having a profoundly positive impact today. It all started with Abby sharing her story. So I just hope that highlights what can happen when information like this is shared. Even on a smaller scale, if you can reach out and help one legislator learn about a disease that he or she didn't know anything about before, great. If you can reach one family with information that helps them identify a problem in their own home, great. So just recognize that you can have a really amazing impact just by telling your story. So let's talk a little bit about how to tell your story. And with this, when you're talking to folks with government, good idea to recognize that they don't know anything about what you're talking about. Just assume they know nothing. They probably don't even know much about rare diseases. And so if you're going to talk about it, you probably have to provide a little bit of very basic information. What it is, how many people are affected, things like that. You can talk using clinical language if you're familiar with it, and many of us are if we're patients, but recognize that they might not understand it. And so it's a good idea to use definitions and use the simplest language possible to tell your story. And then, as I said, understand that they're going to use this information to support the community in the future. So what type of information do they need to do that? Well, they have to understand the burden of disease. So you have to tell them how challenging it is to live with a disease. You have to tell them how it affects your child physically, emotionally. You have to talk about the treatments that are or are not available. You have to let them know how important it would be to have a treatment. And when you do that, it's a good idea to say that it would be great to have a treatment that cures the disease, but it would also be great to have treatments that affect any of the symptoms of the disease. And you have to give them a sense of how you would feel if there was more support and more treatments available for you. What would it mean in terms of you planning for your future, helping others, anything like that? Those are the types of details that they need. And when we think about presenting, opinion about information about your family is a very sensitive topic, and it's very difficult. It's not easy. And so all of us are seeing, TED Talks all the time, or we watch presenters on TV. I don't know if you watch either of the Obamas present. Reagan was a great presenter. And those are the types of presentations that we sort of aim for. And I'm going to suggest that you don't do that. Don't set that bar so high for yourself. Just make sure that you get your messages out in your presentation, and that's all you have to worry about. If you're nervous, it doesn't flow well, whatever, you're not a professional, most of us not a professional presenters, and so you shouldn't aim for a perfect presentation. You should aim for just a presentation that allows you to tell your story, and you should make it as sort of comfortable for yourself as possible and not worry about too much about whether it's a perfect presentation or not. Just make sure that you get your messages out. So in terms of how your presentation should flow, how your talk should flow about yourself, you should definitely start by talking about who you are, where you live, and describe your family, and some information about whether if you work or not, things like that, just a little context about yourselves. And then you should outline your family's health experience. So your symptoms before diagnosis, how you sort of manage that, what you went through, the course that you have to take to get a diagnosis, if that's the case, and then who in your family is affected, what their physical and emotional state is at this point, what types of treatment they're having, what their access to medical care is like. And then you want to talk about the impact that Tay-Sachs has on your life. And so then you want to talk about both your physical and emotional health. How does it affect you? And it's a very good idea to use as many examples as you can and to sort of avoid general phrases like it was really challenging or it was really painful, because those are not concrete. So try to use examples like unable to get out of bed, unable to work, unable to eat. Give them a sense of how it affects your day-to-day life. Those are the things that really resonate when you tell your story. Also recognize that every patient's experience is different, but most diseases have sort of a course of symptoms that can be fairly similar. And so if there are issues in your experience or your family's experience that are unique, really highlight those, because what we want is for anyone who hears from 6 or 7 patients, by the time they're done, we want them to have a very wide understanding of the impact of a disease. And so the more unique things you can talk about, like if it was an early diagnosis, a late diagnosis, if the course of disease progression was aggressive or not aggressive, however your story is different from others, that helps them understand what is a really important issue in rare diseases, that not everyone has the same experience, and that it can progress in very different ways, and helping them to understand that is a really important part of helping them to support the community, because they have to represent the full range of experiences within the community. It's also a good idea to talk about how a disease affects your family, other family members, other children especially, and friends, and how does it affect your ability to socialize, and do your friends provide support, and if they do, what is that like? They'll be interested to hear how care of your family is affected by having someone with a disease, and how you have to restructure your day and manage care while having a job or feeding other children, or all those little details can really make a big difference. And then it's a good idea to include some information about how you plan for the future and how does this disease affect that. Because especially as it relates to things like, your family's future health and things like planning for marriage or planning for a career, if a disease affects those things, legislators should really understand that. As I said, don't aim for a perfect presentation, just try to get your messages across. It's a good idea, even if you're planning an informal conversation about yourself with someone in government, to practice it, to think about it. You could write out every word if you want, or you can just write out bullets for it, but it's a very good idea to practice it and to practice out loud. So you hear what it sounds like, and if you're gonna share someone else to hear it with you, to see what they think, it's a good idea not to say, how did I do? Because people in that context are very supportive and they'll say, oh, that was really wonderful, no matter what. So if you say to them, what should I change about my presentation? What should I change about what I said? That's where you'll find the weakest links and maybe find ways to make it a little bit stronger. Even if you're having an informal conversation with a legislator, if you're nervous at all, it's okay to write out and talk from notes. It's better if you can not read every word, because then your head is down, you're usually not making eye contact. So if you do that, just make sure you keep making eye contact with the person you're talking to. But if you want to use notes, you can. If you want to just wing it, it's up to you. Use whatever is comfortable. We all have phones now that have video on them, so it's a good idea to practice showing yourself on video and seeing what you look like when you do it and hearing yourself. And remember that if you have a limited amount of time, to really time yourself and make sure that you finish within time. And I tend to speak pretty quickly, so I'm bad to give counsel on this, but it's a good idea to speak slowly and to use simple language and simple terms as best as possible, so that people can follow what you're saying and they understand what you're saying. I know it's a sort of sensitive topic, health, but people are more likely to listen to you and more likely to accept your messages and think about your call to action if you smile. It's just simple. Just be friendly as you can and smile, and recognize that they're making impressions about your messaging based on not just what you're saying, but how you're saying it. And they want, they respond well to friendliness. Everything's virtual now, so obviously if we're doing something virtually, it's a good idea to use the camera like you're making eye contact with them. So you're not reading like this, you're looking at the camera and making a connection with them the whole time. What to wear is a superficial thing. It's not the most important thing. But what you want is that your clothing, your accessories do not detract attention from your messages. You want them to focus on what you're talking about, what your story is. You don't want to be the person with the, big eyeglasses or something like that. You want to be the person who told an interesting story about their experience. Don't try to make your language sound more important than it is just because you're giving a presentation or talking. Use simple language as if you're talking to a friend at a Starbucks something. Just make it as conversational as possible. And don't worry about being nervous. Especially in this context, it shows that you care and it shows that you're trying, and it can actually make people more receptive to your message because they really do feel like you're making an effort. So don't worry about things like that at all. Some hints just for presentations in general: have some water nearby. And even if you're talking for 4 or 5 minutes, you can dry out, and so it's a good idea to have a quick sip of water available. Connect online before a presentation, at least a few minutes, so that you know that your technology works. As I said, if you're reading, make sure that you keep looking up so you connect with the audience. Even virtually, it makes a big difference. And for all of us who are Zooming too much these days, make sure you have a light behind your computer or camera facing you. So do it in front of a window or have a lamp facing you so that you're not in the shadow the whole time. And then if you're nervous, no big issue, but if you are, the best way to avoid being nervous is to practice. The more you practice, the better your presentation will be. The thing that makes people most nervous is concern about what they're going to say next and not knowing exactly what they're going to say next. And so the more you practice, the less likely that is to happen. And if you are also nervous and you can't practice as much as you would like, just practice your first minute or two, because if that goes well, usually it flows well from there. And if you stumble at first, sometimes it's hard to catch your breath and get back on track. So practice your first couple of minutes most, and if that's all you have time for, just make sure you get that locked in. If you are reading your notes or if you're speaking quickly, just remember to slow down every once in a while and take a breath and relax. And remember the whole time that, first of all, you're doing them a favor by giving them perspective that they need to do their job well, to understand a community that should be important to them. And so have that power in your voice that you're doing something that's helping them, and recognize that they want to hear from you and they want you to succeed. And when you're thinking about how you tell your story, even if you're talking about 6 or 7 minutes of talking, they're only going to remember a few things, right? And so it's a good idea when you write your notes out to identify those things in advance and to say, when I make this talk, when I give this talk, these are the points I really want them to focus on. I want them to pay attention to these. And when you get to those points in your presentation, flag them. Use the phrase like, this was really important to us. This was something that was devastating to us. Something like that can really help them identify the messages you think are most important and make sure that they remember them. And remember that when you do come to things that are important or emotional, it is okay to be emotional. If you get emotional in these talks, do not worry about it. It shows you're a real person and shows that you care. And then at the end, remember that you do want a call to action. So even with a casual meeting with a legislator, at the end, it's okay to just say, I really hope you'll support our community moving forward. Even a general message like that plants the seed in their mind. But if it's something specific, I want you to support the STAT Act. I want you to do this. I want specific, that's all fine. Give them something to think about and give them something that you hope that they will work on. And there are lots of things in every rare disease community that we hope legislators will do. Sometimes it's support more research. Sometimes it's may introduce innovations in research that can help more drugs get to the finish line. Whatever it is, just make sure that you have a couple of things that you want to ask them to do. It's really important, and they should, in a meeting like this, take something away that's a to-do for them. Even if it's just learn more about this issue, that's good. But even if it's more specifically, learn about sponsoring legislation, supporting legislation, all great stuff for you to tell them. And that is a simple run through of how to tell your story, really basic stuff. But remember that you are doing God's work here. And you are making a big difference. Even with a small story told to a couple of people, it can have a profound impact. And so recognize that and just applaud yourselves for agreeing to do this, because it really is an important thing that works very well in this community. So that will stop sharing.
Great. Wow. Thank you so much, Bill, Abby, and Stephanie, for taking the time to demystify the world of advocacy at all the levels. I think your messages were tremendous and definitely empowering as we share our stories to make change. So I hope you all feel a bit more empowered and take action at whatever level you feel comfortable. NTSAD does share action alerts when they come through, and we'll do it through our community news or our family focused newsletter Lifeline, and on NTSAD's social media as well. So stay tuned. And if there's something you need help with, whether it's information, anything that we can help write up, send us an email. So with that ends our first day of our annual family conference. Thanks for being here, and we hope you join us in the family lounge later this evening from 6 to 7 Eastern. We hope to see you there, and prepare yourselves for tomorrow, our research day starting at noon. So with that, thanks.